Good evening, everyone. Welcome to Pediatrics by Dr. Anand. Is my voice audible to everyone? Please let me know. Good evening, everyone. A beautiful class today, a beautiful day today. Why today is a beautiful day? Because we get to meet, we get to share some immense amount of beautiful knowledge. And please let me know if my beautiful voice is audible to everyone, yes or no. I just came back from gym and today was a wonderful workout I had. And thank you so much for all the love and support. Oh, yes, I can see my face. It's not that bad. It's fine. Average. Average face rocks. Good evening, every beautiful people. Suman, Grace, Himanshu Padhyay, Mansi Panola, Priya Gupta, Suman, Indian lovers and beautiful people. Good evening. कैसे हैं आप सब लोग? I hope you guys are amazing, beautiful, mind-blowing and rocking. Why? Why are you rocking? Just like that, it's good to rock without a reason, I guess. That's what. Let's start this beautiful class, my dear friends. My name is Dr. Anand. I have done my MBBS from Rajiv Gandhi University Health Sciences. Then also I did my MD from MD Pediatrics. Then also I did my what do you call SRship from Lady Harding Medical College, Hinduraw Medical College. Then I became assistant professor. I'm the youngest in my college who is AP. It's good feeling. It feels nice. And my favorite color is red. And I like gobi Manchurian. That just like that I told that. With wonderful, we have some average teaching experience. With we teach to UG, PG, DM, MD, and MRCP students. And what else? What else? What else? That's it. What else do you want to know? Before starting any amazing segment, we always have a beautiful quote. And today's beautiful quote is the ability to observe. It's a very nice quote. The ability to observe without evaluation. The ability to observe without evaluation is the highest form of intelligence. Think, okay, think logically. The ability to observe without evaluation. You're observing someone without evaluating. Like you're not judging the other person, you're just observing the other person, right? Are you understanding? There's a difference between observing and judging. Okay, someone is doing something according to you that is wrong, but that is like your evaluation. But you just observe. The ability to observe without evaluation is the highest form of intelligence. So are you understanding? That's a very beautiful quote. So you need to, what is the morale of the story? The morale of the story is thus that, learn from people, learn from your mistakes, learn from everyone else's mistakes. It's not mandatory that something wrong should happen to you, then you realize and get experience out of it. The wise is the one who get the experience by even seeing the other person's story. Are you understanding what I'm trying to say? Good evening, everyone, beautiful people. Yes, Himanshu Padhyay, brother, I miss you too. Everyone, we had a little long gap because 14th August was Sunday, 15th was Monday, 16th was my dad's birthday, so 3 days we had to miss the class. And did you guys miss Dr. Anand classes? Yes or no? Let's start this beautiful class. Today's topic of choice is CNS. It's like today is a very beautiful day. Why? Multiple reasons. Because we are living, that's the best reason. The second reason is that examination of CNS. In this class, I'm gonna give you a very beautiful glimpse of a CNS. But for this class, the rules are, I want you to, you to think, to logically think and discuss with me. We have some beautiful question and answers we have in this plot. Let's start this beautiful class, guys. The first question is, what is the common symptoms related to CNS? Open your brains, okay? I really genuinely want you guys to rock it. So could you please tell me what are the common symptoms related to CNS? Like okay, I will not tell. What do you think, guys? Can you answer in the comment section? I hope you, I want you guys to try to answer, bro. Yes, exactly. Yes, Dr. Savan Singh has come. Okay, hello Savan, hello Karan, Osama Sheikh, one of my favorite juniors. Yes, thank you so much, Faizan Raza. One of the common symptoms related to CNS is headache. Basic symptom, headache. Oh God, I've got headache, man. Okay, could you please tell me how, like, it's a very beautiful class. Can we talk? Can we talk? We need to talk. Headache. Like, what are the various types of headache? Or if a patient is having headache, what are the leading questions you can ask in a case of headache? Can you answer? Can you tell me frankly? Can you tell me? Okay, if I give you an hint, basically, if I say most importantly that the patient basically in the case of headache, the patient is having a unilateral headache. Which is the commonest cause of unilateral headache? Can you answer in the comment section, please? One-sided. Doctor, I'm having a headache over here, doctor. So unilateral headache, bro. What do you think, bro? Can you answer in the comment section, please? What are the commonest cause of unilateral headache? Yes, yes, that's right. That's you're pretty right. Most importantly, yes. Okay. Can I say migraine? Am I allowed to say that one of the important cause for headache is migraine? Number one. What are the points favoring migraine? The points favoring migraine is like it's a unilateral headache. Basic, है ना? Very good, very beautiful. See, everyone answering very nicely. Talk to me, okay, bro. Talk to me. Life is beautiful. Let's talk and enjoy. In this class, we are talking about CNS. We spoke that the patient can come to headache. If someone comes to headache, then number one, of course, I will like to ask that it's a unilateral headache or a bilateral headache. Is the headache in the full head or it's only on the one side? And one very beautiful question. What are the common causes of headache in a child? Nice question. Imagine, okay, if we are discussing, okay, you are also doctor, I am also doctor. I have a doubt. Yeah. Could you please tell me, sir, what are the common causes of headache in children? Anyone? Is migraine common in children? Is meningitis common in children? Can you please tell me? Is cluster headache common in children? Can you tell me, please? Yes, Osama. Okay, very good. Pulsatile headache. Dr. Shubham. Okay, Arshil. Beautiful. So one of the common causes of headache in a child is migraine. छोटे बच्चों में, even though we have seen less cases, but according to Nelson, Piyush Gupta and Ghai, the common causes of headache in children is one of the important causes, migraine. And also we have tension headache. So various types of headache are migraine, tension headache, very importantly. Can I think of meningitis? Yes, Dr. Faizan Raza is nice, right? Lalit Yadav, Mansi, beautiful, amazing people. Thank you, Dr. Karan Vikram Singh. Okay, शुभम का बर्थडे यार. शुभम, तेरा बर्थडे कब आता है? And Dr. Awesome is right. Ixol, yeah. So let's discuss. Okay, we are amazing. Let's discuss this beautifully. What are the common causes of headache in a child? Remember, number one is migraine. Number two is tension headache. Number three is meningitis. Number four is Ixol, right? Okay, great. Let's talk about it. So now, if a 5-year-old boy, doctor, he's having headache. Doctor, he's having headache. Yeah. So these four basic things you can think of in a case of headache: migraine, tension headache, meningitis, and intracranial space occupying lesion. One more cause we need to talk. Can you tell me any common cause, like before even this meningitis and Ixol? Can you tell me any one, just one cause of headache जो हम यहाँ पे नहीं है? वैसे तो बहुत सारे नहीं है, but can you tell me any one or two important cause which has headache? Anyone? Yes, very good, beautiful. Can I say refractory error? क्या पता उस बच्चे को चश्मा लगना हो? Yes or no? Do you agree with me? Hello. Refractory error is also one of the important causes of headache. If someone comes to me with headache, can we get a off-the opinion? Like for the refractory errors? You never know, the child, it kind of, the eyes are weak and the child is having headache because of that refractory error. Yes or no? Can you tell me? Yes or no? Hello? Yes? Okay, yes, nice, cute. Okay, one more thing. Can I think of sinusitis? Can you please tell me how the headache of sinusitis present? Can you please answer in the comment section? Discuss. You are amazing. We are beautiful people. The life is so amazing. So, okay, first take a deep breath. Now tell me, sinusitis. If a patient comes to you in OPD, you are thinking of sinusitis. How the headache will present? Usually the sinusitic headache, I hope you can tell me, yes, the patient will have a frontal headache. That's very well put. Usually, like in the working hours of the day, in the morning hours of the day, the headache usually rises. Whenever the patient is exposed to sun, when he goes for playing or when he exposed to the sun, his headache increases, is usually on the frontal headache, because sinus, the frontal sinus, the sphenoid, ethmoidal sinus are so inflamed. So I'm having this strange frontal headache, and if I press the patient's frontal sinuses, he will have huge pain. So something which is in the working hours of the day, which aggravates in the sun or in the photo, in the light, and yeah, exactly, these are sinusitis. Okay, very good, perfect. Yeah, so let's talk about it. The common symptom related to CNS is headache. If my patient comes to headache, I must think of migraine, tension headache, meningitis, intracranial space occupying lesion, sinusitis, sinusitis, and very importantly, what else? Refractory errors. Now I have a question. How does intracranial space occupying lesion present? Can anyone answer in the comment section, please? Think, okay, it's a healthy class, it's a logical class. It's not cramming business right now. We are literally discussing. You are the doctor, I am the doctor. We are discussing. How will Ixol present? What do you think? Yes, you have 5 seconds to answer this question, please. Anyone? Savan, Akanksha, Anum? Very good. The patient will have severe headache with projectile vomiting. When someone having a Ixol, the patient will have a severe headache with the projectile vomiting. Exactly, with the projectile vomiting. Very good, very good. Savan, Mansi Panola, awesome. Great. We have a new person known as Martin. Perfect. So the question number one, how does the Ixol present? Severe headache with projectile vomiting, and I think that's a very basic question to ask. Can you please tell me two important more causes of projectile vomiting? Hanji Shubham, please. Can anyone? Projectile vomiting causes? Shubham, हैप्पी बर्थडे शुभम, भगवान आपको सब कुछ दे, बहुत सारा प्यार, लॉट्स ऑफ लव एंड रिस्पेक्ट फ्रॉम माय साइड, मे गॉड गिव यू एवरीथिंग इन लाइफ. शुभम, आई वाज नॉट नोइंग इट्स योर बर्थडे. हैप्पी बर्थडे शुभम. From Vikas Puri from Delhi. The important causes of projectile vomiting are: number one, raise intracranial tension. Number two, of course, I can think of meningitis. Yes, of course. And one very important thing, very good. Amandeep Kaur from our Gautam Nagar Delhi classes, CHPS, congenital hypertrophic pyloric stenosis. The patient will have headache with projectile vomiting. Mind blowing answer. Next question, please. Yeah, this has already been a NEET PG question. This is a NEET PG question. If the frontal headache is more of a sinusitis, if the unilateral headache is more of what you call migraine, how does tension headache presents? Can anyone answer in the comment section, please? Hanji, we have a student who says, what is Vikas Puri? Shubham stays in Vikas Puri. Shubham stays in Delhi, and there's a place in Delhi known as Vikas Puri. He stays there. Yes. Himanshu Upadhyay, yes, bro, you're also right, bro. Come, I'll give you cold coffee. You want cold coffee? Come, we'll have cold coffee. How does tension headache? Oh, ho, Savan Singh, yes, exactly. Yes, amazing, very good. Savan Singh has the right answer. Savan Singh says that usually the tension headache is like a dull aching. It's like a tension band headache. That's very good. Like a band, like एक मीठा मीठा दर्द जो पूरा दिन रहता है. Like a dull aching, mild headache throughout the entire day is a tension headache throughout the entire day. So again, unilateral headache, migraine. Frontal headache, sinusitis. Dull aching headache, whole headache, it is there, whole head is involving, it is throughout the day. Tension headache, tension headache. Yeah. Now the second important symptom in a case of CNS examination is a seizure. So seizure has 1 million questions. I hope you can understand that. Very good. Hanji Karan Vikram Singh, very, very good. Seizure. What is a seizure? Can anyone answer in the comment section? How do you define seizure? Anyone? Any beautiful seizure? Yes. फैजान रजा says, उफ, ये मीठा मीठा दर्द. मीठा मीठा एक गाना था, मुझे याद नहीं आ रहा. ओके. यस. मेरी बात का हर कोई मजाक बनाता है. मीठा मीठा दर्द, बाबा ऐसा ही होता है. दैट्स हाउ इट इज इन द हेडेक ब्रो. इट इज मीठा मीठा दर्द ओनली, कि हल्का हल्का मीठा मीठा. पेशेंट सेज, ओके, हेलो, पेशेंट सेज, डॉक्टर मीठा मीठा दर्द हो रहा है. मीठा मीठा इन इंग्लिश, एनीवन? वी हैव इंग्लिश स्पीकिंग पीपल आल्सो. Little like a sweet headache. Sweet. What is a seizure? I hope everyone, yeah, Dr. Anum has a beautiful answer. Abnormal electrical activity in CNS. Okay. We have Dr. Sen who says paroxysmal electric discharge. Okay. Ayo, Mansi says Dora Parna. Very classy answer. It's a paroxysmal. What is paroxysmal? I don't know. I don't know English. What is paroxysmal? Repetitive. Paroxysmal kind of thing. Intermittent or repetitive. Paroxysmal clinical event could be muscle related, motor, could be sensory, could be autonomic, as in tachycardia followed by relative bradycardia. Paroxysmal clinical event that results from the abnormal electrical discharge from the brain is known as seizure. Okay. You don't have to cram this line, but generally examiner, if he's in good mood, he might ask you, how do you define seizure? He can ask you this question. So it's a paroxysmal clinical event that results from abnormal electrical discharge from the brain is known as seizure. Exactly. Perfect. Next question, please. Seizure. Yeah, this is a good question. This is a very good question. Let's see if genuinely if anyone can answer me nicely. What are the provocative events related to seizure? What do you think, guys? Okay, see, we are discussing, okay, it's a case presentation. I am the examiner. Anji, Dr. Shubham, your birthday is there. बेटे बर्थडे तो चलता रहेगा बर्थडे विल कम एंड गो कुड यू प्लीज टेल मी योर पेशेंट इज हैविंग हेडेक विद सीजर्स व्हाट आर द प्रोवोकेटिव इवेंट्स व्हाट आर द एग्रीवेटिंग फैक्टर्स related to seizure? Okay, I'll just write whatever you guys are saying. What are the aggravating factors? Beautiful Dr. Sawan has answered that infection can provocate seizure. Hanji, that's true. Fever can provocate seizure. Yes, buddy, that sounds classy. Hypoglycemia, I think that's a very smart answer. Someone having hypoglycemia can land up into seizure. Yes, that's right actually. Okay, let's go one by one. Acha. Perfect. Okay, if I say it's a very smart class, please talk. Okay, hello, to participate, live section, type. Okay, type if you want to talk, if you want to be amazing. Someone having prolonged fasting with seizure, what is your single best diagnosis? Single best biceps, so single best diagnosis. If I say only one beautiful question, so agar मान लो कोई भी some festival had come, someone having prolonged fasting with seizure. Dr. Monica Kumari says, good evening, sir. Good evening, ma'am. How are you? Achha, Dr. Sawan, I will shoot you with my gun. Prolonged fasting with seizure, you hypertension. बेटा तेरा hypertension करा दूंगा. आंसर ध्यान से दीजिए. Prolonged fasting with seizure, of course. Can I say hypoglycemic seizure, which is very common, frankly. When I was working as intern in Bangalore in Ambedkar Medical College, whenever a festival used to come where the people used to fast, so we had a lot of patients literally who had come in hypoglycemia. So it's like you take a history, right? If you take a beautiful history, again, as I have heard, as far as the pediatricians are concerned, counseling, and history plays a very important role. Before touching the child itself, just by the history itself, you can come to a very beautiful diagnosis. So, doctor, we were fasting because we had a festival today and there was a seizure. So, obviously, hypoglycemic seizure is the best answer. As we have hypoglycemia, Dr. Shubham, बिना मार खाए, could you please tell me what is the neonatal hypoglycemia cutoff and what is the hypoglycemia cutoff in a case of severe acute malnutrition? We have two random questions. Can anyone beautifully answer in the comment section? You have 7 seconds to answer this question. Your time starts now. कौन मिल गया, कोई मिल गया. यस, यूं तो हम तुम मिलने को मिलते रहे, पर क्यों आज ऐसा लगा, कोई मिल गया, कोई मिल गया. Yes, very beautifully answered by Himanshu, Mansi, Karan, Shilpi, Ritu, Arshil, Yogita, Pandey. Ayyo, so many are there today. Okay, so bro, someone having hypoglycemia, the neonatal hypoglycemia, the RPS cutoff is less than 45 milligram per DL sugar, and someone having SAM hypoglycemia, the cutoff is less than 54 mg per DL. That's right. Also, at the same time, I hope you know that neonatal hypoglycemia cutoff is nothing but like the treatment for neonatal hypoglycemia. Anyhow, it is divided into symptomatic and asymptomatic hypoglycemia, but the treatment in general, if I talk about, either you can continue breastfeeding, but In general, if I talk about the fluids, then I think you know that 2 ml per kg, 2 ml per kg of 10% dextrose is a treatment for neonatal hypoglycemia. And for the SAM hypoglycemia, it is 5 ml per kg, 5 ml per kg of 10% dextrose. Please, next question, please. Next question. Okay. Yeah. Could you please, has everyone understood this much? Yes or yes, yes. 30 minutes class is over. Has everyone beautiful understood? Yes or yes, yes. Okay. Can we move further or should we have a quick repeat revision of whatever we have spoken? Okay, Amrit is right, Amandeep is right, Suman is right, Vrinder is right. Great, perfect. So in this beautiful class, what all we have spoken about it. In this beautiful class, we spoke that most importantly, the ability to observe someone without evaluating that person is the highest form of intelligence. Then also we understood in the CNS, the patient can come with most importantly headache. That could be a migraine. Then also the common causes of headache in a child, I would like to say first will be the child's eyes are weak, refractory errors, or kya tha, what else was, the child had a unilateral headache, kind of a sinusitis. Then I can say migraine, tension headache, meningitis, ICSOL, and all the beautiful points. Then also at the same time we spoke about ICSOL. ICSOL patient present with severe headache with projectile vomiting. Projectile vomiting is also seen in CHPS and ICT, raised intracranial tension and meningitis. Then beautifully spoke about it. The tension headache actually presents as what? ये मेरा वो stuck हो गया. नहीं नहीं ठीक चल रहा है. हाँ. So the tension headache presents as dull मीठा मीठा दर्द, dull aching mild headache throughout the entire day. Then also we spoke the patient can have seizure. Seizure is of multiple types. I will not ask you that question because I hope you know that. It's a paroxysmal clinical event. Could be motor, could be sensory, could be autonomic, because it results from the abnormal electrical discharge from the brain. Also at the same time we have various provocative events, as Dr. Sawan beautifully said, that infection can lead to seizure, fever can lead to seizure, hypoglycemia can lead to seizure. We spoke that someone having prolonged fasting with seizure, prolonged fasting, no, so naturally hypoglycemic seizure, we spoke about it. Yeah, next question please. Ooh, nice question. Seizure following diarrhea. I said again, bro. I said yes, exactly. Yes. What are the provocating events related to seizure? Seizure following diarrhea. What is the best answer? Best one single answer. Anyone? Yeah, itne dil, it's so many hearts you guys have given. Whom are you giving so many hearts? Are you giving to Dr. Anand? Please let me know. या ब्रो टेल मी. ठीक है, समझ में ओसामा समझ में आ रहा है ब्रो. आज ओसामा, शुभांगी, you gave me a call, I called you back, you didn't pick my phone. Yeah, exactly. The best, okay, yeah. Beautifully told by Grace, Savan, Karan, Indian lovers. Yes, beautiful, amazing people, amazing. Yeah, right. So seizure following diarrhea. Yes, very beautifully said. Seizure following diarrhea. I think the beautiful answer are dyselectrolytemia. Could be hyponatremia, hypokalemia, and hypocalcemia. Hypocalcemia. Can we please define hypocalcemia? Can you please beautifully answer in the comment section? How do you define hypocalcemia, bro? Virender has put one picture. Bro, ये क्या picture है, bro? What is this picture, bro? Yeah. Could you please tell me beautifully in the comment section? Yes, yes, yes. Exactly. What is the hypoglycemia cutoff? Can you beautifully answer in the comment section, please? Ionized calcium less than 1. Ionized calcium. See, we have serum calcium and ionized calcium. Some books say serum calcium less than 8 mg per dl, but in general we always calculate the ionized calcium because that's better. Yeah, so ionized calcium less than 1 is the best answer for hypocalcemia. That's the best answer. Next question. Seizure provoked by fever. Ooh. Can you please answer beautifully in the comment section, please? Seizure provoked by fever. Seizure provoked by fever. What is the best answer? Yeah, one single answer. Patient got a fever followed by seizure. One beautiful answer. Can you please give me? Will you write hypoglycemia here? Will you write hypocalcemia, hyponatremia, hypokalemia? What will you write? Please tell me. Beautiful people, tell me. This is a beautiful class. Let's connect. Very beautiful, told by our amazing people. Yes, definitely I can think of febrile seizure. Beautiful, mind blowing answer. Can I revise febrile seizure? What is the drug of choice, bro? What is the drug of choice for febrile seizure? Some baby who got like a 4-year-old child, he got a very high fever. After very high fever, he got a abnormal movement. So my best beautiful diagnosis is febrile seizure after excluding all the other CNS infections and all that. And yeah, what is the drug of choice, bro? Shubham, Akanksha, Karan, Hemlata, Asha, what is the drug of choice? Tell me, tell me. Yes, rectal diazepam. That's true. Rectal diazepam. ये सब, bro. These are exam questions. Okay, don't imagine we are chit chatting and just randomly discussing something. These are exam questions for NEET SS as well as for NEET and next and FMGP, bro. So rectal diazepam and intranasal midazolam. Rectal diazepam and intranasal midazolam is the best answer for the drug of choice. Okay, perfect. Intranasal, yeah, exactly. Intranasal midazolam. I have a very like I always ask questions. Okay, intranasal. Can you please tell me something in life which you can give intranasal? Intranasal. Please tell me, tell me, tell me. What do you think, bro? What do you think? Can you please beautifully tell me something in life which can be given intranasal? Hanji, kaun batayega? Raise your hands. Good boy, good girls, small babies. This one in gym, in my gym today. Like today was not my biceps. Today was my chest and triceps actually. And निके निके बाल आते हैं. मतलब small babies like 18-19-year-old BCom first year and all these boys, girls, they come to gym and they're so happy with me. They're chatting, भैया भैया body दिखाना, भैया body दिखाना, भैया show me your body. अरे भैया आप कैसे abs? This one fellow was telling, I entered gym, I was working out. This fellow, a small boy, first year BCom, he has this small gang of friends. He's like, photo तो आपकी लगनी चाहिए gym के बाहर. Like your picture should be there outside gym. Such a great body you have. Your photo should be there outside gym. I was like, hello, don't say so much. Okay, I'm very lean. He's like, if you are lean, we are not even existing. So we have great fun. Do you guys have fun in your gym or in your badminton and amazing places? You must have a wonderful time. It's a good this thing. Yeah, the beautiful answer is in the vaccination. In the vaccination, COVID vaccine. Yesterday, I was hearing on Radio City 91.1 FM that COVID का intranasal vaccine आ रहा है. COVID intranasal vaccine is on the way, as we all know. And also this one, what do you called H1N1. H1N1 vaccine is intranasal. COVID vaccine is intranasal. Midazolam is intranasal. Yes, exactly. Yes, that's perfect. Okay. Yeah, very good. Yes, very good. Next question, please. Which is the most commonest age group for febrile seizure? Thank you, Dr. Faizan. Nose, Karan is right. Nose clean करने के लिए, हाँ जी, तुम्हारा nose clean करने के लिए nasal drops are very truly we give to the newborn and in general to the patients. Normal saline nasal drops also we give. Open your brain, okay? I want you guys to be the best of the best of the best. जिंदगी भगवान की एक बहुत ही महंगी गिफ्ट है. I want you guys to be the beautiful doctors, okay? Someone having headache now in your OPD, no. You should be like, hello, do you have frontal headache? This headache? That headache? Behind headache? Koni wala headache? Which headache you have? You tell me, I'll diagnose it, okay? That much crazy you should be. Yeah, the beautiful answer on this planet is that only that the most commonest age group for febrile seizure is 6 months to 5 years. Can we please have anyone on the stage who can explain us any other diseases, bro? Can you, Osama kahan hai? Can you please tell me, okay, my question is, tell me any other entity where the most commonest age group is 6 months to 5 years. Osama, Shubhangi and Shubham, I'm seeing your answers. Hanji, who will give the first answer? I will write their beautiful name on this beautiful channel. आंसर मुझे घूरने से आंसर नहीं मिलेगा. हाँ जी, Priya Gupta. Priya always she tells very good answer. Priya is also one of the dedicated followers. See, students who are good, no, their name automatically comes because they are always answering. I never speak Priya names. I always say Osama, Shubhangi, Shubham, tell me the answer. But it's Priya who end up being winning 500 rupees and quiz contest she's winning. So Priya is the right answer. Severe acute malnutrition. Severe acute malnutrition, the most commonest age group is 6 months to 5 years, and the febrile seizure is also the most commonest age group is 6 months to 5 years. Someone saying acute rheumatic fever. Uh, yeah, acute rheumatic fever, as I read in Nelson, it is 5 to 15 years. Acute rheumatic fever, my dear, the most commonest age group is 5 to 15 years. Not 6 months to 5 years, it's 5 years to 15 years is acute rheumatic fever. Exactly, and even Kawasaki, that's very well put. Less than 80% of cases of Kawasaki in less than 5 years of age. That's a very beautiful point. So Kawasaki, roughly around acute rheumatic and febrile and SAM is 6 months to 5 years. Next question, please. Ooh, now this is a beautiful question. So someone was having fever with seizure, you thought of febrile seizure. Someone is having fever with seizure with altered sensorium, bro. Now tell me what is the best answer. I think we can all discuss and tell the best answer. Anyone? Osama? Avinash Yadav, Sohan, Lalit, Akanksha Pandey. Okay. Okay. There's one junior of mine, Ananya Pandey. She's in final year MBBS in our NDMC Medical College. I thought you are that Pandey. Hanji, yes, Osama is right. Yeah, Amrit, beautiful answer, Amrit. Definitely, can I say meningitis? Can I say encephalitis? Can I say meningoencephalitis? Or can I say anyone having raised intracranial tension? That's beautiful answer. Please remember, someone having altered sensorium, undoubtedly encephalitis is something I need to connect. Someone having fever with seizures. Listen carefully. Hello. Fever with seizures, it should be meningitis, but encephalitis has to be an altered sensorium. Someone having only fever with seizures, meningitis could be a beautiful possibility, but someone having fever with seizures with some altered sensorium, GCS going bad and this and that, then definitely encephalitis is something I need to add in my diagnosis. Always remember. अच्छा और क्या था? One more question होता है. Yeah, GCS. What is the lowest GCS you can give to any child? The options are 0 by 15, 1 by 15, or 2 by 15. Yes, can you answer in the comment section? Quick answers, please. What is the lowest GCS given on this planet? 0 by 15, 1 by 15, 2 by 15. Can you answer in the comment section? And Osama, I am seeing your answer. Hanji Priya, let's see who beautifully answer. Okay. बच गए बेटा, वरना मार खानी थी आज. Nice. Anyone who wants to say something else? Clever people. Very clever people. So, the lowest Glasgow Coma scale, bro, it is always 3 by 15. GCS can never be can never be less than 3 by 15 because the EVM, eyes, verbal and motor, 4, 5 and 6 points, the total is 15 by 15. The maximum GCS on this beautiful planet is 15 by 15. The lowest GCS on this amazing planet is 3 by 15. The GCS can never be 0 by 15, 1 by 15 or 2 by 15. Acha, Akanksha Pandey has told less than 3. Akanksha, चप्पल का है मेरी. Okay, we can't hit girls. Okay, Akanksha, cute, very cute answer. Less than 3. किसका है less than 3? किसी का नहीं होता less than 3. Akanksha, less than 3 is nothing. Okay. Yeah, Suman says it never be 0. It can never be less than 3 by 15, bro. 15 by 15 is the maximum GCS. 3 by 15 is the lowest GCS. When should I put the baby on ventilator? Which GCS I should put the baby on ventilator? Exactly. Amrit, never ever fall for the traps of sir's option. Ooh, oh, you are our regular follower, so you know the drill. Hanji, can you please tell me, Dr. Shubham, बेटा तेरे आंसर लेट आ. शुभम, योर आंसर्स आर कमिंग लेट. व्हाट इज दिस? तेरे को ब्लॉक कर दूंगा मैं, बता रहा हूँ मोबाइल से. Karan, yeah. So can you please tell me ventilator? Hello, I have to put the baby on ventilator, bro. Tell me what GCS? 10 by 15 GCS. Can I put 15 by 15 GCS on ventilator? Can I put 15 by 15 GCS on ventilator? Yeah, thank God. We should not put because it's like, why you want to put, bro? So 8 by 15 sounds a beautiful answer. Someone having 8 or less than 8 actually. So yes, that's beautifully put actually. So you have to put the baby on ventilator. Next question, please. Oh, nice question. Someone having fever with seizures with cafe outlet spots. Such a beautiful question, guys. Can you please answer in the comment section? These are like $1,000,000 questions. Can you please expand your brain? Fever with seizure, febrile seizure. Fever with seizure with altered sensorium, meningitis, encephalitis, meningoencephalitis. Fever with seizure with the cafe outlet spots. Yes, what's the best answer? Can you please answer in the comment section, please? Mansi, sone sone patole lakha. Karan, Osama, yeah, yeah. Which neurofibromatosis? As very beautifully people have told, cafe outlet. Acha, हाँ. NF1 or NF2? Are you speaking about what is the other name of NF1? Yes, very good, very good, very good. Fever with seizures with cafe out late spot. What are cafe out late spots, Hanji? Can you please answer in the comment section? If this is a picture, could you please explain me? I have no idea. This is my OSCE question. I am a DNB student, and they told these are like hyper pigmented patches. Is like a birthmark. Is this beautiful things are nothing but cafe au lait spots? Where it's nothing but like a birthmark. It's like a hyper pigmented skin patch which is circumscribed. Where do you see that? In NF1 or NF2? The answer is NF1. And has anyone told what's the other name of NF1? अच्छा, शुभम सेज वैन रोसन. कौन है ये? तुम्हारे तुम्हारे ये किसका नाम है? तुम्हारे बेस्ट फ्रेंड का नाम है वैन रोसन? हु इज वैन रोसन? हु इज वैन रोसन? एंड नाउ शुभम विल से सॉरी सर, ऑटो टाइप हो गया, सॉरी सर. So beautifully told by Shreya Prakash. Yes, the answer is von Recklinghausen disease. That's beautifully put. Von Recklinghausen disease is the best answer. Yeah, you know, Shubham, 3 days back we had a class on this one. What you called in Delhi we had a class. Okay, in DPGI, wonderful platform, and there were a lot of students. We had so much fun that day. We spoke about cardiology and the CNS, and the students are laughing. Like I had uploaded a video. If you have seen it recently, please watch the latest Instagram post of mine. I have uploaded one video. Students are laughing like anything, and they are answering so well, and they are having so much fun. And I am also laughing. I was like, oh my goodness, what is this? Like, why are we all laughing? I should be strict in the class. So what do you think, guys? Should I be strict in the class? Should I speak less and should be very strict? What do you think? Put an answer in the comment section. Ooh, this is a picture, bro. I have seen only one patient in my life, or real patient I saw. The patient was coming for a follow-up in medicine OPD. I was going to casualty to see a child, and suddenly on the wheelchair, I saw this patient with so many lesions on the face, on the hands, on the back. I was like, can you wait? Can I take a picture, please? And that's what. And today we are discussing with the rest of the planet. Yes, exactly. So this is neurofibromatosis, guys. This is a very important picture. These are like neuromas. These are plexiform neuromas. Neurofibromatosis. Please remember that. Okay. Yeah. Very beautiful question. What if I say a triad of port wine stain with seizure with this white deposit, intracranial diffuse calcification? So what is the best diagnosis? Port wine stain, seizure, and where is the port? Where I'm having a port wine stain, I'm having a contralateral. On the other side, I'm having seizure with intracranial calcification and glaucoma on the same side. What's the best answer? Asha, yes. Pandey says, you are only one of your types, sir. Exactly. I think I'm unique. Someone says that are you mad? I was like, I think I'm unique. Unique sounds classy, no? Mad is like mad, like that, That's it. Yes, the beautiful answer on this planet is Sturge Weber. Who told the right answer? Dr. Anum Dr. Anum says Church-Strauss syndrome. Before I killing Dr. Anum, she deleted the message respectfully. Good for you. Hanji, next question, please. Hanji, yes. Okay, Jaswant is calling me. Okay. Good evening, sir. क्या हाल है मेरे भाई? मैं फ़ोन पक्का उठाऊंगा, मेरी क्लास चल रही है, लाइव क्लास, इसलिए मैं उठा नहीं रहा मैम का फ़ोन. 9:30. कल तो मेरी यार क्लास ऑलरेडी लगी हुई है, कल कैसे? मुझे बस 10 मिनट दे, मैं मेरी 9:30 क्लास खत्म हो रही है, करता हूँ तेरे को कॉल. कैब की तो क्या बात है ब्रो, कैब की कोई बात नहीं है, मैं तो कर लूँगी. हाँ, नहीं मैं, हाँ मैं, हाँ नहीं ब्रो, मैं समझता हूँ, कोई टेंशन नहीं, कुछ करता हूँ मैं मैम से बात करता हूँ. पर यार मैं फिर बहुत कम समय ले पाऊंगा ना, मेरी 5 बजे ऑलरेडी नर्सिंग की क्लास है, कैसे करूँ? चलो कुछ करता हूँ, मैं आधे घंटे में कॉल 9:30 कॉल करता हूँ, मेरी लाइव क्लास चल रही है. हाँ जी, ठीक है डियर, ओके बाय बाय. या आई अपोलोजाइज फॉर द फोन कॉल. यस. Okay, Hanji, can we move further? Yeah, Sturge Web is the right answer. It's a good question. I would like to thank Dr. Anurag for this. Dr. Anurag Ved, one of my very favorite juniors from Kashmir, and he had sent me this picture of a Port Weinstein, guys. Please remember. Yes, that's true. Next question. The third beautiful symptom on this planet is nothing but altered consciousness. Altered consciousness. So हमने क्या क्या पढ़ा, guys? What all we have studied, my dear? So we all have beautifully studied. What else? The patient had headache. What else? The patient had seizures, and the patient had altered consciousness. Okay, that's a beautiful thought. And the patient can also present. Yes, that's right, bro. The patient can have hemiparesis. The patient beautifully can have hemiparesis. Of hemiparesis, we have some questions. What is hemiparesis? What is paresis? What is plagia? I always get confused. I always get confused. Can you please answer in the comment section? Dr. Suman, thank you, Dr. Suman. That's very kind of you. Akanksha Pandey, please answer. What is paresis? What is plagia? I have no idea, bro. Please. This is the first time attending Dr. Anand classes. Could you please tell me what is paresis? What is plagia? Yes, paresis is weakness, bro. Paresis is weakness of, if it is one half of the body, it is hemiparesis. If the full four body weakness, that is quadriparesis. I hope you know that. So, and also what is plagia? Beautiful. What is inability to move one half of the body? That's a nice question. Paresis, you told weakness. Paresis, you told weakness of one half of the body is paresis. है ना? Paresis. Very nice. Very good. Okay, paresis. And complete inability to move one half of the body. What is the answer? What is the answer? Who will tell me? Yes, beautiful. So the best answer, complete inability to बिल्कुल भी move नहीं कर रहे तो बोल के it's plagia, right? Yeah. So weakness is paresis, and the complete loss of motion, the 0/5 power, not even flickering 1/5 is 0/5. Plagia. Now, what is paraplegia? Ooh, now this is one question. I always get confusion diaplegia and paraplegia. We have monoplagia, hemiplegia, quadriplegia, diplegia, paraplegia. What is paraplegia? No idea. No idea on this planet. Could you please tell me? Please, please, please. Para. Para matlab pair. Paraplegia, weakness of both lower limbs with sparing of upper limbs. Okay, weakness of both lower limbs with sparing of upper limbs. That is para. Para matlab pair. Okay, para matlab lower limbs. Okay, para matlab pair, lower limbs. So the weakness of both lower limbs with sparing of upper limbs. Very good. So Suman, okay, now not all limbs would be quadri, no? Faizan, all limbs weakness or complete loss of motion will be quadriplegia or quadriparesis. Para is pair, है ना? Remember that, dear. Oh, Indian lovers, nice, nice, nice. She made a pair. Okay, cute, cute, very cute. What is monoplagia? Mono is easy, sir. What is mono? Mono is one-sided. Any one limb, one-sided weakness. One limb, one side of the limb is monoplagia. One half is the hemiplegia. Paraplegia is the lower limbs. Pair involved होते हैं lower limbs. Okay. Quadriplegia, everyone knows all four limbs are involved. Quadriplegia. If I have a weakness in all four limbs, it will be quadriparesis. That's true. And diplegia. What is diplegia? What is diplegia? Okay. Okay. Yeah. What is diplegia? Anyone? What is diplegia? Okay, Karan says ये PSM practical professor का question था. That's true, bro. This is basic question. And you know, like my HOD always used to say that common things are common and rare things are rare. Okay, common things are common and rare things are rare. No one will judge you if you don't know that in Lish-Nyhan syndrome it's a self-mutilating disorder. No one will judge you if you don't know that in Lish-Nyhan बच्चा अपने आप को खुद काटता है. The baby, you know, hit or hurt himself with self-mutilating behavior with a non-megaloblastic macrocytic anemia you see in a case of Lish-Nyhan syndrome. Just now my HOD had told 2 days back. But if you don't know that, it's okay. No one is gonna judge you. But if you don't know what is paraplegia, then you will be judged on a very high scale. Remember that, okay? Hanji, next question, please. The next question, yeah. So that's yeah, exactly. This thing is not working. 1 second. Yeah. I think it's already 50 minutes are over. So in this beautiful class, we spoke about very importantly, yes, the patient will have what? So it's a monoplegia, hemiplegia, diplegia, and quadriplegia. Yes, exactly. So that's what this is important. Yeah, lower is more than the upper. That's true. That's very well put. So para is over. Yeah. Now how to rule out? So the class is coming to an end now. So how to rule out proximal upper limb weakness? So we have two type of weakness. No? We have a proximal limb weakness and a distal limb weakness, right? Yeah, very good. So how do you rule out proximal muscle weakness? Can I answer in the comment section? Proximal. How do you rule out proximal upper limb? So weakness, to ruling of weakness, we have a upper limb weakness and lower limb weakness. In the lower limb weakness, so we need to ask questions to the child, right? So how do you rule out? Yeah, that's right. Pick an object from the shelf. Someone think, okay, proximal. This is the upper limb. This is the upper limb, my biceps, upper limb. This is the proximal part. This is the distal part. So like combing. Can you please tell me combing? Anyone? Yeah. Okay, very beautiful this thing. Someone saying getting up from the squatting position. I'm sorry, but what do you call? I'm asking upper limb, dear, upper limb, not lower limb. No, upper limb proximal. Dr. Grace says, please shed some light on Sturge-Weber. Sturge-Weber is a very beautiful topic, my dear Grace. You just have to wait little because we have a separate class on neurofibromatosis where I'm going to talk about this neurofibromatosis type 1, Sturge-Weber and tuberous sclerosis with all the pictures and MCQs. So wait, that will be a dedicated class. It will be very easy. So don't worry. Just wait for some time. Okay. So yeah. So upper limb is divided into proximal upper limb weakness and distal upper limb weakness. Proximal is like combing. Combing is a proximal upper limb weakness. Picking something from the shelf. Picking something from the shelf is upper limb weakness. Very importantly, combing. Oh, cutie pie. How many of you love kids? I really love kids. It's beautiful. Like I can literally stop the class and just think about this baby. It's beautiful. Like I'm really happy. To be a pediatrician. This is cutie pie. When I was in NICU for 1 year, I remember like I used to hug the babies, and that too it's not allowed because the baby can have sepsis and all that. But once they're totally out of sepsis and blood culture is sterile and the baby is fit for discharge, then only I used to hug them, and it was a beautiful feeling. So combing is very importantly, bro. Proximal upper limb weakness. That's very well put. Next one, Hanji. Yeah, exactly. Now I don't know what I have written because the picture has gone there. So yeah. What about buttoning and buttoning? Can you tell me buttoning and buttoning? So buttoning and buttoning is a distal muscle weakness. Combing, proximal weakness. Picking something from the shelf, proximal weakness, very importantly. And last, now the class is over, bro. What do you call it? Yes, thank you, Dr. Suman. How to rule out distal upper limb? Can you answer? Savan, answer this. Let's see who answer first. How do you rule out? Galat, if you give a wrong answer, then you see me. My eyes are big and you see me. हाँ जी बताओ जल्दी बताओ tell me fast anyone Dr. Mozam Ahmed says you're looking handsome, sir. Thank you, bro. Thanks, bro. Let me know how can I look more good. Actually, I've started gym and I got a haircut. This side. Shubham, ठीक लग रहा है बाल? How's my haircut? It's like a jhadu haircut, but it's very cute. So thank you. बेटा शुभम तू तो गया काम, तू मिल बाहर मिल को. हाँ, exactly. So dressing and resting. Okay, I'm sorry, but okay. Dr. Savan. Distal upper limb is right. Yeah. That's right. Can I say writing in the pencil? Beautiful picture. Hello. Buttoning and buttoning, yes. Writing pencil, holding a pencil. Yeah, I have two amazing questions here. Can you please tell me when does immature pincer grasp comes? Immature pincer grasp comes, and when does mature pincer grasp comes? And you answer in the comment section, please tell me. Hello. Immature pincer grasp and mature thank you. Yeah, exactly. Yeah, and I have recently put my one amazing picture right now on Instagram. Someone is free, watch them, you will be shocked. Shubham देख के बताइए मेरे को, Insta पे डालिए मैंने अभी on the story. Please let me know. हाँ जी, in the immature if I'm holding something beautiful, what is beautiful I have? What should I hold beautifully? कहाँ पे? Like if I show you my bag, no, you'll be shocked. Like see, my bag is always full of toffees. I have a Melody, I have Kiss Me, then I have Vicks ki goli before my throat. So my bag is always full of toffees. So if I'm holding something with the thumb and index finger, that's a mature pincer grasp. It comes by 12 months, 1 year. Very important question. And if I'm holding something with thumb index finger and assisted finger. That is like a immature pencil grasp which comes by 9 months. 9 months exactly. So 9 months is beautiful. This one, the thumb, index finger and assisted fingers, like that. And bro, this one is like a proper thumb and index is like a proper mature pencil grasp, comes by 12 months, comes by 12 months exactly. Yeah. Yeah. Shubham has Osama has told a very beautiful answer. But Osama, this is something that my external had asked me. My external had a question. Okay, I have a question to you guys. How will you ask mature pencil grasp? How will you ask? I have a question which Osama has already answered. Can anyone else think on answering? How will you ask mature pencil grasp to a mother? How will you ask mature pincer grasp to a mother? Okay, can your baby do that? Like if you want to ask mature pincer grasp, what do you want? What will you say? Holding a pencil? What will you say? Huh. Yeah, yeah, okay. Yeah, so just okay, I'll just type my Instagram. This one, it's pediatrics by Dr. Anand, bro. Pediatrics by Dr. Anand. Just type that and you'll get it, my Insta profile. It's very easy to get my Instagram profile. Okay, huh? Okay, Dr. Savan says holding spoon. I'm really sorry, but that's a wrong answer. Holding spoon or holding a pencil or holding something big, okay, need intrinsic muscles of the hands and lumbricals also. So no, that's not the right answer. Anyone else? Anyone else? So Dr. Osama has already told a very beautiful answer. Dr. Osama has told a very can I reply to his answer? Okay, we can't reply the answer. So Dr. Osama has told a very beautiful answer कि क्या आपका ये ओसामा ने क्या आंसर किया? 1 second. हाँ, अंगूर खा लेता है, अंगूर पकड़ लेता है आपका बच्चा. Can your baby hold a grape? Okay, can your baby hold a grape or a pebble? अंगूर उठा लेता है. So whenever a baby will उठाओ the अंगूर, whenever the baby will pick the अंगूर की English क्या होती है? Grape, no? Whenever the baby will pick the grape, so he will pick the grape like this. Imagine if this is a where is it? If this is a grape, no, he will pick the grape like this. Okay, a 1-year-old you will not give kiss me lychee flavor to that baby. Okay, of Parle G company, right? So it's like अंगूर खा लेता है आपका baby. Can your baby have अंगूर और अंगूर की क्या इंग्लिश क्या थी? अंगूर की इंग्लिश क्या होती है? ग्रेप, नो? ग्रेप, या. सो ही विल होल्ड लाइक दिस. That's a beautiful mature pencil grasp. This I was literally not able to tell to my HOD, my external. She was very good, I remember, and she's like, "How will you ask pencil grasp?" I was like, holding a pencil, holding a pen, holding this, holding that. But she's like, and I was knowing holding something with the thumb and index finger. But what is the natural, basic, everyday something which the baby will hold with thumb and index finger? So whenever the mother is feeding the child, like in general, my HOD said, like my external said, that आपका बच्चा अंगूर खा लेता है, अंगूर पकड़ लेता है. So अंगूर or a pebble or a grape holding is nothing but mature pencil grasp. Oh, Dr. Savan. Dr. Savan says, can your baby hold a diamond? Which diamond? Are you talking about single solitaire? It comes 1 lakh rupees, or the diamond with single solitaire which I have put in my ear? That diamond. Dr. Savan, we are not talking about your childhood. You must have holded a diamond in your future, in your past when you were 1 year old. But India is a developing country, so holding a grape sounds better. Diamond and all that, you meet me outside. Has everyone understood this much? Yes or yes. Yeah, that's right. Dr. Muzzam Ahmed says, saw your status where you have providing proof of your putting weight. Yeah, thank you so much. So that's it. Oh, Kohinoor. भाई हो गया, आज का हो चुका है कहानी. अब प्लीज अपने अपने घर जाइए. Today's session is over. Thank you everyone for the participation. Yeah, exactly. Can we have a very beautiful and very, very amazing quick revision of what beautiful class we have spoken today? We'll go with a wonderful speed, okay? I will not increase the speed. Will discuss as much as possible. Exactly. Dr. Suman is right. Diamond is not good. He can put in the mouth. Yes, that's very well put, my dear. That's very well spoken, my dear Suman. Very true. So in this beautiful class, we spoke about that the ability to observe someone without evaluating someone is the highest form of intelligence. Then also we spoke in the CNS, one symptom we spoke is headache. If I'm having a unilateral headache, I thought of migraine. If I'm having a frontal headache, I thought of sinusitis. If I'm having headache with little blurring of vision, I can think of my eyes are weak, refractory errors. This beautiful beautifully spoke about it. The common causes of headache, we spoke: migraine, tension headache, meningitis, ixol, sinusitis, and refractory error. Then also we spoke that the ixol will present like fever, headache with projectile vomiting, and projectile vomiting we thought of CHPS, raised intracranial tension, and meningitis. Tension headache, we spoke that the patient will have a meetha dull aching headache throughout the entire day. Seizure also is important symptom. Seizure, we spoke that the patient, they're provocative events. Someone was fasting whole day, then he got a seizure. I think hypoglycemia sounds the best answer. Someone was having too much of diarrhea followed by seizure, then I think of course he would have had some dyselectrolytemia. Then also we spoke that hypocalcemia is nothing but ionized calcium less than 1. That's important. Ionized is important. Serum, not the serum, ionized. Then also we spoke someone having fever with seizure. I think febrile seizure sounds a very beautiful answer. The most common age group is 6 months to 5 years. Then also we spoke that fever with seizure with altered sensorium, definitely encephalitis or meningitis or meningoencephalitis. Then fever with seizure with cafe-au-lait spots. Of course, it is neurofibromatosis, NF1, also known as von Recklinghausen disease. And yeah, that part is over. This is a very classic picture image-based question of neurofibromatosis. It is of two type 1 and type 2. Type 1 is also known as von Recklinghausen disease. Then also we spoke someone having a port wine stain with a contralateral seizure with some intracranial diffuse calcification and glaucoma on the same side. I must rule out Sturge-Weber. Port wine stain, classical picture of Sturge-Weber. Then also altered consciousness is important point where we spoke about other symptom. The fourth symptom is hemiparesis. Paresis is weakness, plagia is complete paralysis, hemi is one-sided, mono is one limb. That's it. What else? Yeah, that's it. So paraplegia is important. Para matlab pair, para matlab feet, para means feet. Weakness of both lower limb with sparing of the upper limb. That's important. Okay, so monoplegia over, hemiplegia over, quadriplegia over, and diplegia are over. Okay, what else? Then also we spoke that the upper limb weakness and lower limb weakness. Upper limb weakness is divided into proximal upper limb and distal upper limb. Proximal upper limb, I can think of picking an object from the shelf, combing. What else? Yeah, I think that's what, even combing. A beautiful picture. Then what else? And the distal upper limb, of course, buttoning, unbuttoning, and writing something and holding a pen. Yeah, so beautiful. Holding the pen and buttoning and buttoning. Beautiful picture, buttoning, buttoning. And yeah, even making chapatis. Can you make chapatis? So making chapatis like a distal muscle. Some adult patient, having a problem, what you called, then you can ask the patient, do you have difficulty in making chapatis? And she or he will say, yes doctor, I cannot lift, fold the chapatis like that. So that's distal muscle weakness. Yeah, that's it. That finishes today's class. Has everyone beautifully understood the whole amazing part? Yes or yes? Thank you so much, everyone. Okay. Dr. Savan, you can do the maneuver. Okay, great. Perfect. Thank you so much, everyone, for this beautiful participation. I had a comfortable time talking to you. I hope you guys had some good time talking to me. This was the CNS examination part 1. Now we'll be talking about for a lot of days about CNS examination and a lot of amazing stuff. I have read some 3-4 books and I have made these points. So this class is excruciatingly important. And thank you so much. And remember, जिंदगी भगवान की एक बहुत महंगी गिफ्ट है. नंबर 2, टेल योर सेल्फ यू आर अ ब्यूटिफुल सोल, यू आर अ अमेजिंग सोल, यू आर अ माइंड ब्लोइंग सोल, you are the most beautiful person of your life. So just take care of yourself, okay? Don't give your thread of life to anyone else. Don't fall in love with someone so much that you give everything to the other person. You must have a conglomerate. Conglomerate की हिंदी मुझे आती नहीं है, but you must have a shell around you that loves someone, but don't be so much affected that you end up, disturbing or destructing yourself. You are the most beautiful thing which can ever happen to you. Love yourself, take care of yourself, and just love yourself. Just enjoy your company. Enjoy being you, and because you is you, and you is unique, and you is so beautiful. Like, I really love myself, and I really appreciate myself, and I really groom myself. I go to gym, I talk good, I read a lot of motivating novels, I eat good food. Whatever you feed your body and soul, it comes out that way. So I feed my body and soul some good stuff. I always have, kind of, if you know very well, I always have some plants in always near near my bedside, in my washroom, in outside, everywhere I have a lot of plants. So we all are improving. I play Sudoku, one Sudoku every day. I'm very good with Rubik's Cube. I can do 3 by 3, but I cannot do 4 by 4 and 5 by 5. Savan can do 5 by 5. He's good. So these are the beautifuls. I have it, I think. So I want you guys also to have some amazing things about you. You just have to realize how amazing you are. That's it. You just have to realize how beautiful you are. The day you realize that you are amazing, you will fall in love with yourself, you know. So stop getting frustrated, stop getting angry for no reason, stop getting distracted for useless things. I mean, I think peace of mind is the most expensive, most luxurious, and most crazy thing which you can achieve. And once you have got peace of mind, I mean, there is no way looking back. Thank you. Take care. Bye bye, and lots of respect. Yeah, it's a money plant. Money plant is the only plant which can grow in the water. You don't need soil for that. Money plant, and one more plant is also there. I don't know the name of that. My ma'am used to have it, and it grows without soil, and it just grows like that. It's amazing. Thank you. Bye bye. Take care. See you tomorrow, 8:30 p.m. Okay. Take care, bro.